I'm Susan Hogeland. I'm Executive Vice President of the California Academy of Family Physicians, and I'd like to talk to you about Covered California. Only 14 days remain until the end of open enrollment through Covered California, our state's health benefit exchange established through the Affordable Care Act. Yesterday, Covered California announced that 1 million Californians have enrolled in health care coverage during this first historic open enrollment period. That number considerably exceeds their initial projections from last fall of 696,000. To avoid the last-minute rush, please take the opportunity with patients these next 2 weeks to encourage them, their family members, and friends who may not have health insurance coverage to go online now at www.coveredca.com. Covered California also reports that 85% of enrollees have paid their premiums, which is required for coverage to take effect. 43,000 people signed up in just the first 9 days of March, which likely speaks to the real demand for health insurance, since, as you likely know, healthcare costs are one of the leading causes of bankruptcy in our nation. Interestingly, yesterday, the Kaiser Family Foundation issued an analysis of how competitive the insurance market is under the Affordable Care Act, and California and New York were featured. The report said that each of the two states shows a significantly more competitive insurance market today when compared to their overall individual markets in 2012, using 3 separate measures of competitiveness, including market share of the largest insurer, the number of insurers with at least 5% market share, and how evenly market share is distributed across insurers. This is also good news. You may know that CAFP and 3 partners received a grant from Covered California to encourage physicians, physician assistants, and office staff members to refer patients to Covered California. Our faculty members have been or will be at a chapter meeting near you, and we've held numerous monthly webinars to help you advise your patients about accessing coverage through Covered California. Our magazine, California Family Physician, carries articles about Covered California, and you can also find information on our website, www.familydocs.org. At the same time, we have been in contact with Covered California to call their attention to some of the problems physicians and patients have encountered with regard to websites listing which physicians are signed up for which health plans, and some mistakes have been made. Patients need to know if they can continue to see their current physicians if they pick a particular plan. Also, we've had reports that health plans contracts have reduced payments to physicians between 10 and 40% for Covered California patients. For Covered California to be successful, patients must not only have health insurance coverage, they must have access to care through primary care physicians, especially family physicians. CAFP will work with appropriate state agencies responsible for network advocacy on that front, and we encourage members to read health plan contracts carefully and to negotiate. Meantime, we got to get them signed up, so please do what you can to help. Thank you, and thank you for listening.